My name is Dr. Chris Watson. I'm a lecturer from Queen's University Belfast. I lead a research team that are focused on improving heart health through the development of new treatments and tests for heart disease. So our study is focused on heart failure. There's about 20,000 people living in Northern Ireland with this condition. It's a very serious disease and can lead to reduced heart function, resulting in less blood being pumped around the body. We have recently discovered a new protein in the heart of patients with heart failure, and this protein is linked with heart function and heart health. Interestingly, this protein is also detectable in the blood and saliva of these patients. This study will be in two parts. So firstly, we'll validate original findings by looking at this protein in the blood and saliva from samples of patients with heart failure from the UK, Ireland, Italy and Greece. Then after this, we'll develop a cheap and simple lateral flow test as a new diagnostic for heart failure.
Hi, my name is Dr. Claire Tunnery and I'm a postdoctoral research fellow here at Queen's University Belfast. The funding from Chest, Heart and Stroke has enabled us to take this discovery and expand upon it, so we can test the protein in a larger number of patient samples, and we'll also have the resources to develop this new diagnostic test. Patients will be accustomed to lateral flow tests. They're very similar to the types of tests that were used when we were monitoring for the presence of COVID in the community during the pandemic. So the lateral flow test would allow earlier detection of heart failure, which would greatly improve outcomes for patients who have the disease. And also patients with heart failure would be able to use this test in their own homes to monitor their disease and make sure that it's not progressing or getting worse.